Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
And somebody else wrote in and said, is there a resource for teenagers on the spectrum if they are at risk, depression, suicide, that they can talk to? So some of the things I just said, but Dr. Grand-Pichet, in terms of the other, have we covered that in what we've just talked about, or do you have more to say?
I think if there's an LMFT at Asner Center, that would be a good person. We have an LMFT at CARD who also is on the show often, Vince Redmond. He would be very savvy about that as well. I used to do this, and unfortunately I don't do it anymore, but UCLA does have a program for teens on the spectrum who are experiencing depression, so UCLA would be a good place to call. The Children's Hospital in Orange County also has a program for individuals on the spectrum. I would really suggest that you look at the larger kind of centers at universities for individuals on the spectrum, because they do often have depression hotlines, or especially if you say something like suicidal, then everyone's going to pay attention and immediately try to help. But given that issues with teens are a little bit different and on the spectrum is a little bit different, I would make sure that you contact the larger clinics, because they will have resources.
I gotta say, I love Dr. Jed Baker wrote a book, and I can never remember the title of it, but it's something like dealing with teens and depression. Oh. And it's something just like generic like that. And I think the book is like $11 on Amazon. And there is one chapter in it that's devoted to individuals on the spectrum. But the rest of it is just for teens. And the thing that I love about it is I think you can go and read a bunch of books about depression and how do you deal with depression in teens. But he deals with the main core issue, which is how do you get them to want to work on it? And he gives you case studies and goes through and says, okay, so here is this instance, and here is how, somebody wanted to work on it, but then we tweaked it a little bit to get buy-in from the teen. Because I never thought about this before, Dr. Grand-Pichet, but the fact that teens don't know anything different than what they feel. Mm-hmm. So they don't understand that, if I do this, I could potentially feel better. So they don't participate in, even if you go and get them help, they often don't participate in it. So I think it's a great read for somewhere between $11 and $13. It's Dr. Jed Baker. And I think it's super helpful, but, and you can get it on Amazon. That's the thing that I always refer to.
Yeah, absolutely. And I think that would be very helpful for parents to kind of understand the process more. I'm just, as a licensed clinical psychologist, I have to tell you, when someone gets a diagnosis of depression, we're not talking about them being sad. We're talking about clinical depression. And clinical depression and suicidal behavior, your logic isn't very functional at that point. You're not someone who even wants to help themselves. So it becomes really important to have a team of people watching over you, because you will need medication to immediately help. A lot of times when we worked with patients who had clinical depression, until they were on antidepressants for a month, it was virtually impossible to give them any kind of cognitive behavioral activity or exercise to do, because they didn't want to get out of bed. So, it's important to control the environment so that they cannot bring harm to themselves. And then it's important to gain control of their biochemistry with medication and diet and exercise as well. And then it's very, very important to give them cognitive behavioral activities that'll help their thinking change, and that helps them to learn how to regulate, learn how to self-soothe, learn how to self-reward, all those things that we all kind of need in order to get through life. But it's a process, and it's a little scary, right? When someone is really depressed, because it feels like you can't reach them. And so that's, I think, where you need a lot of help.
Thank you so much for that. Because I think a lot of times we think, oh, maybe if I just wait, it'll work itself out. But we should get help as soon as possible. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.